Hi everyone, it's Lisa Henderson here to discuss data sets and information management and their use in nursing practice to enhance patient care. Healthcare databases are systems into which our healthcare providers routinely enter clinical and laboratory data. One of the most commonly used forms of healthcare databases are our electronic health records. Practitioners enter routine clinical and laboratory data into the electronic health record during general workflow to document patient care. Some of the advantages of electronic health records include collecting and storing patient health information within electronic databases, which enables clinicians to keep track of our patients' conditions over time. Information can also be quickly accessed anywhere at any time, and all of the relevant information is kept in one place. Using electronic health records can help clinicians give patients treatment that is more effective and better aligned to patient needs. Other examples of healthcare databases include our claims databases, which are maintained by payers for reimbursement purposes, pharmacist databases, and patient registries. Healthcare databases can be used as data sources for generation of meaningful data. Why are these useful? Well, the use of routinely collected data, such as data from our electronic health records, allows assessment of the benefits and risks of different medical treatments in real time, as well as the relative effectiveness of interventions and medications, providing validating evidence to support treatment. It's based on real-time data and can be carried out quicker and faster than some of the more traditional randomized controlled trials to give us some quick information, especially for quality improvement projects. But there are some limitations involved. One of the limitations is that healthcare databases, they're not generated solely for research. So healthcare professionals are not necessarily trained on data collection or input. So the process may not be clear, resulting in an incomplete or inaccurate database. But training and education can help offset this limitation. Without proper validity tools in place, healthcare databases can also become incomplete or inaccurate. Without proper setup, some important details may be missing. The quality and completeness of data can also vary within and among databases. So data quality checks within the collection system are necessary to detect incorrect or missing data and ensure that their differences among databases are identified and accounted for. In just a short time, electronic health records have been able to collect a significantly large amount of data regarding patients' personal health information. And we are always seeking ways to optimize our electronic health records. So this means taking a closer look at those who use them the most, specifically nurses, who are our largest user group. So one of the things that we are looking at is documentation optimization. We realize that nurses feel like they are spending most of their time documenting in the electronic health record rather than caring for patients. We want to increase nurse satisfaction and workflow efficiencies. So one of the ways we can do this is to decrease the documentation burden on frontline caregivers, allowing you to focus on patient care and improve patient outcomes. Big data refers to large amounts of data. One of the major incentives for hospitals to invest in big data is the ability to lower overall healthcare costs. In the United States, we spend far more on healthcare than the rest of the world for the same and sometimes even poorer outcomes. Data analysis provides many benefits if we are able to study and apply it in a meaningful way. For example, cost containment could be achieved by evaluating high-risk patient behavior and provide early interventions which might limit the decline in their condition. There have been new payment systems introduced into healthcare recently, such as population health management and patient-centered medical homes. While these are great ways to meet patient needs in the community, they put increased pressure on organizations like ours to lower costs and improve outcomes in order to remain financially consistent. Using big data, we hope to be able to predict patient outcomes and tailor care to certain patient populations. We can prevent unnecessary readmissions adverse events, or other delays in patients getting well. These outcomes can have a significant impact in reducing costs in the delivery of care at the patient level. Technology for reducing health care costs, reducing adverse events, and preventing readmissions requires healthcare data interoperability, or data through platforms to improve clinical efficiency and reduce provider frustrations. Our Epic system, which is our organization's electronic health record, allows us to exchange data with many other providers, which can ease transitions of care and improve patient safety. Further forging connections with other organizations, including insurance companies, can facilitate more efficient and cost-effective care delivery. It is important for us to understand that healthcare data actually belongs. Remembering this will help us see the importance of sharing data across organizations, even with competitors. This can improve patient safety by reducing duplication of tests, as we have readily access to lab work or imaging studies or other provider progress notes, and seeing what patients have done within other organizations can help us move forward in a more efficient healthcare system. In Central New York, we are fortunate that Epic can connect with other local organizations, providing us this opportunity of shared data. One of the challenges to interoperability is healthcare data standardization. The vast amount of data available is only useful if there is standardization. As we struggle with that, it is hard to manage large quantities of data without a common way to present information. If we are able to seamlessly integrate data from silo systems into single systems, we will need industry standards and ensure everyone follows these, allowing us to glean meaningful data as a result. Data safety helps us protect our patients' privacy, and this is a serious responsibility for us as healthcare providers. It is necessary to have the appropriate measures to safeguard our patients' privacies. Data exchanges in the United States is strictly regulated on both federal and state levels. HIPAA rules provide guidance on personal health information disclosure and necessary protective measures to guard against data theft. These security safeguards require organizations to implement appropriate interventions to ensure patient privacy is safeguarded. Some security measures to safeguard patients' data include password protections, dual login sign-ins, ongoing staff education, and clear process and expectations for how data is stored, used, and protected. Especially as technology continues to emerge and new ways for data breaches to occur or patient health information to be shared come about, we will have to remain vigilant in order to maintain patient data safety. Protecting patients' privacy and health information is everyone's responsibility. Overall, we see that big data is comprised of data that exceeds the human comprehension. It is an unmanageable volume by standard computer systems and continues to accumulate at an unprecedented rate. In nursing, we desire evidence-based practice where healthcare providers have an improved understanding of the patient experience using data science and can use this comprehensive view of the patient for innovative treatments and interventions with real-time evaluations of their effectiveness, allowing us to make adjustments and modifications as needed in order to meet the patient's needs at that time, and to anticipate future needs of our patient populations as we study and learn patterns and trends. Increased collaboration between health information technology standards technology and nursing standards practice at point of care is vital to facilitate communication and information flow among interprofessional team members. Nurses can help bring the gap between nursing practice standards and electronic healthcare documentation of care smaller. Communicating with informaticists to help develop documentation which reflects comprehensive evidence-based and standards-based nursing practice will advance nursing practice and foundational supportive data. Naturally, nurses are good problem solvers and decision makers. Committed to the National Equality Strategy, we can contribute by staying committed to the strategy of having the triple aim, which includes improving care, improving health, and lowering costs. It's an exciting time to be practicing in healthcare as we look forward to all that technology brings and the benefits and be cautious of some of the safety security risks in the future as technology continues to develop. Thank you for watching this presentation.